So you got some explaining to do.
Got some explaining to do. Well, actually, one of the things I want to talk about today is the money that we bring into the county. I'd like to put just a little bit different spin on it. And contrary to popular belief, we do not stand at the windows at the county office building and throw cash into the streets.
Oh, you don't?
No, sir.
My old job used to sometimes used to think it'd save money if we did that.
The windows don't open either.
Okay. Mr. Smith.
Yes, sir. We have, glad to have Department of Social Services this afternoon, and Miss Debbie Jones, who does a great job for us as Director and representing the Department of Social Services, and turn it over to her at this time, sir.
Thank you.
All
Good
right.
afternoon, Ms. Jones.
Good afternoon. Looks like you guys have had another long day.
We have. Learned a lot.
Please stop me at any time when you want some questions answered or you want some elaboration. What you have before you is our mission statement, which is to empower all individuals within the county to improve their quality of life. Through this mission, we hope to ensure the health, safety, and well-being of children, adults, and families, help people obtain the basic necessities of life, and promote the highest level of social and economic self-sufficiency. We are the largest department. We have 200 full-time employees. I do not have any part-time employees. The total budget last year was right at $20 million. Only 24% of that was county dollars. 24%.
24% of the 20?
Yes,
million.
sir. Let's see. One of the things that we've been most proud of since I came to the county about 4.5 years ago was the creation of a specialized child welfare team that works with the Seymour Johnson Air Force Base. This team works collaboratively with the family advocacy group that the base has, and that has been very, very helpful for us. When we do have a child welfare case that involves personnel from the base, then this one team consistently interacts with their one team, and we have group decision-making, we have total involvement. It's really easy to pick up that phone and call who you need to talk to, and that, I think, has fostered a wonderful relationship with our base. I will tell you that some of the horror stories I hear from some of the other directors across the state with their other bases and other branches of service are nowhere near what I can brag about. We've got a great relationship, and we value it very, very highly.
I want to interject something, Ms. Jones, that the BRAC grades that very high on their score list. In 14-15, that's one of the items that they'll look at is community involvement from the health care and quality of life. Thank you so much.
Correct. In last fiscal year, we had 2,838 Wayne County children were involved in assessments or family assessments where we were looking at were they abused, neglected, or had they become dependent? Had the parents abandoned them and they needed surrogate parents to help make decisions? That number is in line with the rest of the state. We really have no more, no less. Our numbers are in line with most of the other counties. Currently, we have 83 children in the foster care system, and we talked a great deal about foster care yesterday. Last fiscal year, we were able to adopt 24 Wayne County children into permanent loving homes. Currently, we have 21 children who are waiting to be adopted. Unfortunately, some of those children, that is not going to happen for them, either due to their behaviors or their age or other issues that are there, which is a sad situation, but we do the best we can to locate families.
Can I ask you on that?
Yes, sir.
What means are we using to develop some interest in adoption? Are we working hard to reach out through the web and other means in order to get prospective adoptive parents?
We do within the guidelines that we have to stay inside of involving the confidentiality of these children. It's a very fine line. When I listened to what Ms. Falconer was saying about advertising and showing pictures of her pets that are available, it's very difficult for us to do that. We have to have permission of many people involved. We do participate with Families First across the state. There are magazines, there are internet websites that are handled by the state, and we do put some of our children on those sites.
Well, I say that. I say that from the standpoint that you hear stories of where American families are going overseas and adopting children, and are we doing everything we can to get our children promoted for adoption?
We do. We try, and that is a problem. And I will tell you that families go overseas because they want an infant and because they want a Caucasian child or a child who physically resembles them. And oftentimes, as we've seen with some of these foreign adoptions, the child that they bring home in 2 to 3 years has major problems that
well, I
they
would
were not
hope that we
informed
would
about.
use every means available.
We do, and we actually get some adoption money from the state every year based on the number of children that we adopted the previous year. And we use that money to advertise, to have events where we talk about what children are available. And frankly, most of our adoptions occur with our foster homes. Many of our foster homes are interested in fostering because they want to adopt, and they see that as an avenue.
Thank you.
So we do recruit that. In fact, just recently, we had a class, and we had 15 families interested in becoming foster parents, so we're working on getting them licensed now. Child support. Child support collected $14,396,754.96 last fiscal year. Thanks to Mr. Parker.
Good job, boy.
Thanks for the judges.
We have 9,000 child support cases. Child support is critical, and it's a critical component of DSS that's often overlooked in the scheme of things. But when a custodial parent receives a reasonable amount of child support, then she is less likely to be standing at my door wanting some of the other services, wanting Medicaid, wanting food stamps, and so forth and so on. So it's very important that we get that child support out there.
Excuse me, that's a big enlightenment to me. You mean that you all handle all the collection of child support?
Not all of it, not all of it. We handle cases that the individuals receive Medicaid, for instance. If they come to us for Medicaid,
Okay.
or Work First, then yes, we'll help them with that, but in turn, you have to tell us who the father of your child is, and it's an automatic referral over to child support, and they start working the case.
Oh, okay.
So,
Seek 'em
So
out.
a lot of child support is paid through the clerk of court, I assume, or just paid?
right, I
Yes.
will. Private child support.
Okay.
If
Yeah.
the mother handles it privately and goes through an attorney, then that does not come through us.
Okay.
However, if the private sector chooses, they can come to us for child support services and pay a $25 fee, and we work their case as well.
For $25.
Yes, sir.
Yeah,
It's cheap.
Boy, you too cheap, man. Yeah.
Thank you.
Services to adults. This is an area that has skyrocketed for us, in part because of the baby boomers, in part because of the economy. We've seen, there's 193 reports for abuse, neglect, and exploitation last fiscal year with adults in our county. This fiscal year, so far, and we've still got a few months left to go, there's been a 35% increase in the number of those reports. Not only are these cases more of them, but the cases are more complex. When I first started out in adult services years ago, they were fairly simple. It was neglect or it was abuse, but now it tends to involve all three. We've got abuse, we've got neglect, and financial exploitation. And who is mistreating these individuals? Almost always it's a child or grandchild. And the things that people will do for a $400 Social Security check will break your heart. The things that we see and deal with. This is growing. This is going to be the trend. The next 10 to 15 years, I predict you will see child welfare begin to take a back seat. The emphasis and the funding is going to be headed toward adult services.
I'll try to be nicer to my daughters.
Well, remember, she will pick your nursing home.
That purchase in Raleigh.
Although my children tell me they're going to keep me around for entertainment value. Currently, DSS is guardian of the person. And this is 72 incompetent adults. However, that is incorrect. I did another count yesterday, and it is 83. 83 incompetent adults. That is a 93% increase in just 2 years. Now, you might ask, what is an incompetent adult? This is an individual over the age of 18 that the courts have said is incapable of handling their own affairs. And typically they'll find a family member or someone who will work for that individual and be that responsible person, be the guardian. When there is no family member, or the family member is the one who mistreated them to begin with, then it becomes social services. And so these individuals require essentially the same care that our foster children do. They have to have a place to live, they have to be fed, they have to be clothed. All of those things have to happen. It's very intensive casework, very involved for the social workers.
Question.
Sir?
It's just curious, did that 93% growth come out of new cases found absolutely, or did they evolve from some other service that became no longer in existence?
That's a very good question. Those are new cases to us. We're one of the few counties that did not receive an influx of cases from the local mental health system.
That was what I was trying to.
And the reason for that is because they didn't have a whole lot to begin with. If they had, we would have gotten them when that happened. But we did not. We were fortunate in that. But that means we already had them.
Okay.
We already had them.
Okay.
So, you know, these are new cases.
But as we sit and learn through these sessions we're going through, I'm always looking to try to connect the dots.
Yes, sir.
If something is going to stop being served over here, where did that population come from? Where will they end up?
Exactly. And many of these cases are coming from O'Berry and Cherry, long-term residents who have been there for years, that a lot of times their mothers, the fathers were the guardians. They have passed away. There's nobody else to be guardian. Doctors will not see these individuals without somebody to sign consents. And so by default, because they're in our county, we're getting.
Well, they were a state responsibility. They
Or-
were a state responsibility.
Or responsibility of a relative who's passed
okay.
away. That's
Okay.
typically what we're seeing now.
And the neighborhood's too big at that facility.
Yes.
Yes, yes. But they may not have originally been Wayne County residents.
Right.
They may not. They could have come from anywhere in the state. So in this instance, it is problematic for our county in that it cost us. We are responsible for licensing and monitoring the 20 rest homes and adult care homes that are in the county. As this does not include the mental health licensed homes, and there are many, many of those. We do not monitor those. However, we do investigate adult protective services reports in those homes. as we also investigate Cherry and Oberry when there are APS cases in those facilities. Okay. Food and nutrition services. Y'all won't talk about NC Fast. I know you
NC slow. but go ahead.
do. We call it NC Not So Fast. We offer nutrition benefits to low-income individuals and families who qualify. And this is a key word for me when I talk with the public, because one of the things I'm usually asked is, do they deserve it? That is not a criteria we are allowed to look at. Do they meet the qualifications? It is an entitlement program. If they meet the qualification, we have no choice but to give them the benefits. And the one thing I'd like to really point out to you here is that last year, over $37 million worth of federal funds flowed into Wayne County through this program. It was spent Walmart, Target, all the grocery stores. That's money that came into the county through this program. Food stamp cases, 15,945 food stamp cases.
Tell them how many that averages per month.
A lot. A lot.
5,000 to 7,000?
We've seen a 73% increase in the last 2 years. And this is, again, directly related to the economy.
Don't a lot of them drop out or get to the end and start reprocessed back through the same people over and over again?
Actually, no, not with food and nutrition. And the only ones that we see that drop out and then come back typically are the construction workers who we used to see in the cold weather months when there wasn't much building going on, and they would qualify during the cold months, and then spring they'd start working again and they'd drop out. But no, many of these people are long-term.
I'm actually thinking about another program, sorry, I should ask that question then.
Okay, you bring it up again when we get there. NC Fast, that's the new software program that the state has put in place. It has been an issue. It's a good plan, and it will be, in the end, a wonderful thing when we get there. Right now, most people with their food stamps, they recertify every 6 months, the vast majority, which is to say, if you're receiving now and we recertify you today, in 6 months, you're going to have to come in and prove to us all over again that nothing's changed. You're going to have to bring your bills in, bring your income statements, and we're going to have to recertify you again. A very small number get recertified annually, once a year. But that's a small number. Most people, it's every 6 months. So what we're doing now, we're in the midst of converting all of those cases as they come due into NC Fast from the old system. And that is taking up to, sometimes, honestly, the supervisor was in my office crying today, 7 hours to convert one case. It's just incredibly time-consuming. The more people in the household, the more children, the longer all of it takes. Now, the good news is, in the end of April, we will have worked through our 6 months. And we are hoping to see a change then. Part of what we're experiencing is the counties were brought in groups. And at this point, all of the counties are owned, with the exception of Mecklenburg and Forsyth. They are coming on this weekend. Each time a group of counties has been added, the system has gotten even slower. So I'm really concerned about what's going to happen this weekend when the great state of Mecklenburg comes on.
Yeah.
Yes, sir. We're worried. We're really worried. And we'll just have to see. And after this weekend, the old system will be turned off completely turned off. So it's going to be, it's either going to be sink or swim. I'm sure you've all had complaints from the community. We all have. The only comfort to be taken is that the complaints are all across the state. And that hasn't been a lot of comfort to me. When somebody calls me and says, I don't have any food in my home, my children are hungry. We've done vouchers to any group that has food to distribute. We've done fundraising at the agency. We raised food ourselves. I allowed them to dress down and pay to dress down and wear jeans every day for the entire month of February, and we raised about $350 doing that, which was turned over to the Salvation Army to purchase food at the food bank. So we're trying. I know you're hearing complaints, we're hearing them too. We are doing everything we possibly can do. And my workers are tired. I will tell you that they are exhausted. Any questions?
And that's just the first product. They got 4 products to come.
Well, they have actually stopped the plans to go to child welfare. That has been suspended completely.
Indefinitely?
Yes, sir.
Okay.
Yes, sir. Well, they've had so many more problems than they anticipated. And Medicaid was expected to go live this summer. To my knowledge, that has not been stopped, but they were counting on some funding from the Medicaid expansion as part of the health care bill. So when the state turned that down, they also turned down some funding for NC Fast. That may delay Medicaid as well. We'll see. I'll keep you posted. I will be asking for a new food stamp worker in the new budget.
Ask.
Well, yes, sir. It doesn't hurt to ask. If I don't ask, I certainly won't receive now, will I? Medicaid, fiscal year 11-12. You see the numbers. Adult Medicaid case, that was an increase of 36% from 2010. 427 adults currently, no, my mistake, excuse me, last year. 427 adults received rest home subsidies in order to stay in the rest home that they were living in. And you see your total amount there. The average cost of stay in a rest home is about $1,200. Part of that is typically paid for with their Social Security check or their retirement check if they have it. The difference in what it costs is what's called SA, Special Assistance, and that's where we come in. We pay that difference to the home itself if they qualify for the program, if they qualify for Medicaid.
Is that amount funded from a federal level, or is that coming from local funds?
That is federal and state.
Federal and state?
Yes,
No
sir.
local funds there.
The only part that's county is half of the worker's time, who's determining eligibility.
Yeah, okay.
Administration.
Yes, sir, admin.
Yeah.
540 adults received long-term care, which is a higher level of care, skilled nursing care, that you would find in the nursing homes. And of course, you'll see, you're talking quite a bit more money. Well, that's because the average cost of care in a nursing home is about $6,300 per month.
If you're lucky.
And that's not local funds there either?
No, sir.
Okay.
No, sir.
34 million?
Yes, sir. That's,
You read it right. That's why I was looking at your face. You read it right.
that's 1
I thought
month.
my glasses had messed up.
I did too.
1 month. Family and Children's Medicaid cases has not increased as much. That's gone up 9% since 2010. So we haven't seen quite the increase there. I will also be asking for a new worker in adult Medicaid, mainly because of the increase that we've seen. Plus, if they do go forward with NC Fast, then you know we're going to have some delays there. And these delays could be disastrous if you're talking about people staying in the nursing homes where they have to be. So you can see that is terribly problematic, and it's really going to be important that we stay on top of that. and process those cases. Any questions?
Could I go back to this $34 million?
Yes, sir.
That's $63,000 per adult. $63,000 annually
Yes,
per adult.
6,300 per month.
per month.
No, $63,000. If you take 34 million and divide it by 540,
Yeah.
that's $63,000 annually.
That's, yes.
63,000.
Divided by 12 gives you your monthly.
Mhm.
60.
That's a lot of money. And what type of care, long-term care?
Long-term care,
Nursing
skilled
homes.
nursing care, skilled nursing homes.
It was 5,200 about 3 years ago, now it's gone up about 60 minutes.
Those remember on Wayne Net and our EMS folks, we do a lot of work for those places,
That is
a lot of
a,
calls.
that is a very high money-making business.
You said that, I didn't.
It is. And they have a very strong lobby
Mhm.
in the state of North Carolina.
One of the strongest.
Yes, very powerful group.
What's the name of one of the, Brithaven, would that be?
Yeah, and it changed to Willow.
Britthaven has changed
To Willow?
all of their names.
Yeah, they've all, you,
They've all been purchased or bought out.
Sun,
No,
Bridge.
sir, it's still the same owners.
Change the
It's,
name.
it's very typical for facilities to change
To
their
change.
name every 2 or 3 years,
Sure, the same
perhaps
owner.
after there's been
Shed-
some bad publicity.
Shed the liability, move on to a new LLC.
And of course, they're certified, and once they become overly accommodating the mental part, that's what the Blue Ribbon Committee was, the commission was appointed, that I served on in reference to mental, the mental part of people that over 50%.
Right, and-
were had mental sickness.
Right, but
Which
that's,
jeopardized their certificate.
and that's back to the rest home care. That's the lower level of care, but you're right, the institutions for the mentally ill, that's correct.
Yes, ma'am.
If they had more than 50%, they were in jeopardy of losing their funding. However, it is very rare for individuals to own one facility. They tend to own several. And so what sometimes happens is shuffling around of residents and moving people from this home to that home to make your numbers work out.
Well, let me ask this question.
Yes, sir, Mr.
The reluctance of our state to accept the Medicaid dollars, does that have any relationship to that $34 million of Willie?
Only in the sense that if that money had been accepted and if those, I believe that it was 500,000
People,
new
Right,
people who would
right.
qualify,
right?
then that number would be higher because a certain percentage of those individuals would qualify for or need long-term care.
So the 540 would increase to that 500, is that?
Yes,
you're
sir.
saying that
Yes, sir.
That 540 could become 680, I mean,
Yes,
just
sir.
pick a number.
That's exactly right.
My goodness.
So those folk are out there somewhere living less than what they could be living. I mean, being less taken care of. I mean, because.
Well, that's true. That is true.
I'm talking about how,
Yes,
I'm
sir.
always wondering if they're not here right this minute, where are they? If they're not receiving good care, where are they? And, and everybody wants, Americans just want that highest level of what we can get,
And I will say that those are the individuals that I see when we have the hearings in my office, the local hearings. The people who make too much money to qualify for Medicaid, or they really don't, they're okay income-wise, but there's a farm that's been in the family for generations. And those are the people that they really can't afford to pay privately for this care. They don't qualify for Medicaid. And those are the family members that are struggling to make sure that grandma is taken care of. And that's when you put together all these little piecemeal things. I'm not sure if Erin's talked to you from the senior center, and the respite program that she has, it is a key component of that because you're trying to cobble it together. Those of you who are parents, remember when your children were in daycare and one of them was sick and your wife had to go to work and you had to go to work and the juggling you would have to do? It's the same thing, except now it's mom and daddy or grandmom and granddaddy. And those are the people who would suffer. Now, on the other hand, you're correct in that more people would receive service. But we would also be more overwhelmed trying to get these people authorized. So that would be a component of it too, is there's no way we could process that many more people. We would have to have more workers in order to do that. So
Well,
with everything.
And that was one of the things that the information's always said, is that it would produce so many more jobs. And then that means that there's so much more money to be spent at Piggly Wiggly and Rose's and Walmart and everywhere else. So it spurs the economy and therefore helps that economy that we were talking about needs to be helped. But I'm not thinking about that side of it right now. I'm just thinking about the people who are out there, but I hear you saying that it's a category of folk that typically the children are there, children or grandchildren, and they're juggling it to keep granny okay.
Sometimes, but not always. Not always. Sometimes it's a matter of they can't afford the treatments, the cancer treatments or the whatever, and so I see people will come in my office and say, if you don't give me Medicaid, I'm going to be dead in 2 months' time.
And that's unfair for people who have worked so hard to help to build this great America that we have. Because now, as our hair starts to get grayer, we're going to be in that category.
I understand.
All right.
And it's a difficult place to be when I have to say we have to adhere to the policy, because not following the policy will get us all in court faster than anything that I know of. It really will. And so I am a stickler for that. If the policy says you can't make more than $245, then I'm sorry, that's where we cut it off. And if you leave my office crying and I sit down and cry, that's just the way it has to be. Because part of what I have to do is to protect this county and my agency from being involved in situations where we were trying to help somebody but we crossed the line. And we just can't do that. Any more questions? Okay. Work first. This is the old welfare check. If you ever hear anybody talking about the welfare system, this is what they're talking about. Welfare changed to Work First several years ago. Work First has consistently dropped all across the nation, and the reason why is because Work First reform was successful. When the government, federal government said, we'll give you a check, but you're going to work for it, you're going to go to school, you're going to learn a trade, we're going to limit it to 5 years, it was successful. The rolls have consistently dropped. We have a very, very small program right now. 365 total cases. And if you'll look at the number, when it says 267 payee cases, payee-only cases, what that means is grandparent, aunt, somebody, or parent receiving SSI does not have to go out and work in order to get that check because of the way the regs are written. So the vast majority are getting a check to help take care of a child. You have to have a child in the home to qualify for this program at all. We have fewer than 100 people drawing a check and having to work or volunteer or go to school in return for it. And frankly, the reason why is look at the amounts of the checks. They don't want to work 35 to 40 hours a week and draw $181 a month. So that program has been successful. That is one of our, in fact, it probably is the smallest program we have right now. And if you'll see the total amount, the $272 for 3, that's the maximum. Doesn't matter whether you have 2 children or 16 children. That's the most you're going to get right there.
Yeah, that's where my question applied earlier, because I used to see them started this thing and decide they really didn't want to go to school, they really didn't want to work, then they drop them out, and 2 weeks later, they'd change their mind, they go back and reapply, and they start the whole process over again.
Now, we do see some of that, and part of the reason for that is because in order to receive, they have to name the parent, the other parent of those children, and then we make the referral to child support, and that process starts.
And our relationship, I was on the other end of that.
That's
so I got
right.
to see all
That's
that.
exactly right. So once, say it's an absent father, once he finds out that they're looking for him for child support, he'll typically go talk to the custodial parent and say, you don't want to do this, you don't want to do this. And it is a bit of a roller coaster, that's true. Any questions on this?
No, but our tape's running about 8 more minutes.
Oh, all right, I can talk fast. Transportation, Medicaid transportation. We are mandated, and in the folders that you were handed out is a listing of the mandated programs that we have, which is virtually everything we have to do. And also a list of the indicators that we'll be working on at Social Services this year. We have to provide transportation to any Medicaid client who asks for it. If they need a ride to a medical appointment, we have to provide that. That means either Gateway, or if they have a vehicle, we provide a gasoline voucher. That should pay just enough for them to go to and from the doctor's office, to and from the drugstore to pick up their medications. We also have to provide transportation for the Work First customers.
A quick question here. You got 422 Work First customers. But up here in Work First, you said you had 365 total cases.
Good question. I knew y'all were going to catch that. I knew it. I knew it. And I'm ready for you. Because when a Work First customer is going to, say, the hospital, say she's volunteering at the hospital, she can't just go and leave her 2 children at home unattended. So she has to take the children, say, one to daycare and one to, for instance, school, where the child goes to school. Gateway charges us for each individual on the bus.
Okay.
So that's how we factor that, is the riders that are going along with the Work First person. And typically it's children. Child care subsidy. We provide subsidy, which is assistance, to individuals who need help paying for child care so that they can work. You'll hear the term working poor. They're working at McDonald's. They're working at some of these places. They're nursing assistants. They're making very low wages, not enough to pay for expensive child care. So we come in, these are federal dollars, and we assist them depending on what their expenses are. And you'll see when you look at that total, that's $4 million, just over $4 million last year that went to local Wayne County child care centers, local businesses. Money that's coming into the county, federal dollars.
We still have a waiting list.
Yes, we do have a waiting list. There's a waiting list all across the state. Funds brought into the county, this is, we've already talked about this. Most of it, we did not talk about the heating and cooling dollars. I know is a particular favorite of Mr. Keene's. Also federal dollars coming into the county. And then the transportation funds that are paid to Gateway. Concerns, I need an additional income maintenance person in food stamps. We've talked about that. One in Medicaid. The increased time demands caused by NC Fast. For months now, my food stamp workers have been working late, working over. As we talked about, they are absolutely exhausted. I need an additional adult services supervisor. Those escalating adult services cases have become too much for one person to supervise well. They're intensive, they require a lot of knowledge, and we just lost our adult supervisor who had retired after 32 years. 32 years. We need 2 supervisors in that unit. The unemployment benefits that were decreased is going to cause more people to come in for food stamps. So when their benefits go down, they're going to qualify for food stamps. So we'll be seeing those people. We also are anticipating filing fees for some child support motions that we have previously not paid. We are asking for a waiver statewide in that. I don't know that that will happen, so that is a potential extra charge. The sequester effects, the TANF and the SSBG cuts, we don't know yet. We do not know what that's going to look like. We know it won't be good. I've heard anywhere from 9% to 20-some%. It will affect us. Gas prices will affect us as well, because when we give gasoline vouchers for Medicaid appointments, that will factor into it. Social workers are mandated to see children twice a month or more often. That's a lot of gas that we have to pay for the vehicles. That's going to affect us. A new one that's just come out is the adult care homes that we were talking about, the rest homes, the adult care homes. In the past, they have received money through Medicaid that compensated them for taking their residents to medical appointments. That has stopped. Those people will now be coming to us to arrange transportation for their residents. So that's going to start flowing through us as well, which will be an increased workload for the transportation workers. And those are my biggest concerns. Any questions?
They save the best to last.
Just ran out of time.
I just want to ask one
Yes,
more
Mr.
question.
Cromartie.
Yes, sir. Yes, sir.
This is just, and it's.
Not a Medicaid question.
No, yes, it is. Yes, I'm sorry, it is. We talking about the group that will not be added on to the rolls because of that farm and so forth and so on. If we could just give a sense of where the overall economic level of those people are. Are they below the poverty level, above the poverty level?
I would say they're just above the poverty level.
That was it. That's my last question. Thank you, ma'am. I just want
Yes,
to know.
sir.
Thank you, Mr. Cromartie. Any other comments or questions? Thank you, Ms. Jones. Okay, we're going to wrap it up. Mr. Smith, you have any?
Mr.
Anything you'd like
Archibald,
to
good
add?
afternoon. Thank you all for your patience and
Any
your
commissioner
listening
wish to comment?
skills.
Mr. Bell?
I would just like to say one thing to Ms. Jones. At the rate we've been working lately, we're going to have to go down and apply for some food stamps.
Mr. Dotter?
Are we supposed to be able to Greenville tomorrow morning?
You have,
Isn't that tomorrow morning?
yes, it
8
is.
o'clock.
Yeah, I believe so.
At the Greenville Hill.
Breakfast at 8, I think, and it starts at back 9.
Starts at 9.
What time do we have to be in Greenville in the morning?
Well,
Flipping over.
breakfast is 8 to 9, and the program starts at 9.
Yes.
Are we riding the van individually?
Mr. Daughtery, do you have any comments? Mr. Mayo?
No, sir.
Mr. Cromartie?
No, sir.
Mr. Pate? Mr. Acott?
No, sir, except this has been very interesting day, just